So I joined the fellowship thinking that I was going to fight inequities in healthcare. But then I think back and I realize that I don't have like a very successful history track. When I was 17, I wanted to be a poet, a writer, a musician. Then I realized that you need talent for that, and well, it didn't happen. Then when I was 15, I wanted to be an astronaut. And I had like a brief romance with physics, but I'm not an astronaut right now, so also didn't work out. Then when I was 8 years old, I wanted to be an archaeologist. I loved dinosaurs. I was one of those like kids. I learned every single name. Didn't work out, right? But when I was 5, I wanted to be a Power Ranger. So obviously that didn't work out. So I ended up becoming a physician, a doctor. Now, I want to do a mental exercise with all of you and go back a little bit to show you how I see what this means. It's 2020, it's 2 a.m. in the morning, you're in the middle of a busy emergency room, and then all of a sudden, an elderly lady walks in. She's grasping for air, and you know that there's very little that you can do. You feel scared, she's scared, we have nothing to offer. It starts to feel something weird again, right? Fast forward one more year, 2021. Again, 2 a.m. in the morning, an old man, kind old man, goes into emergency room, shortness of breath as well. Nothing has changed, nothing you can do. But now, it's 3 a.m. in the morning, and a young man gets into the ER with a stab on the chest. Very little that you can do. 4 a.m. in the morning, a young pregnant woman gets into labor. There's some history of drug use, no prenatal care, diseases that are complex. You deliver a premature baby, the baby dies a couple of hours later. That starts to feel like a failure again, right? You tell yourself, these are the stories that you tell yourself, right? Like, if I want to do this every single night, I gotta keep my distance. I gotta harden my heart. Well, I believe that that's a lie. From time to time, there's certain things that ground you, right? And I want to tell you another story. All of these are real. This is another real story. A couple of days later, on a busy night, I go into a patient's room. He just coded. That's like the medical jargon of I was dead and now I'm alive. He's stable now, so we had the chance to talk. He asked me, is the hospital busy? And I'm like, yeah, but I like gossip, so I'd rather hear your story. So I sit with the patient. I talk with him for hours. He's from my same neighborhood. He likes the same tacos that I like. We connected. We talk about life, about death, the fear of death. He tells me that this is not his first time in the rodeo. 8 months ago, he had a similar episode, and he's been on a waiting list for more than 8 months, just waiting for being put off the list and being fixed. A broken heart, literally a broken heart. Now, this night, we're just waiting for a hospital bed in a third-level center to be open so that we can transfer the patient to that place. That's the only thing that we're waiting. I'm on the phone, screaming to every single person that picks up the phone and be like, hey, I need a pacemaker, I need this, I need that, open the bed, I can't wait. No luck. A couple of hours later, the patient dies. For a brief moment, in my head, I'm like, well, we did everything that we could. It's fine. Then I realized that the rage and the anger was gone. And that is true failure. Now, in my quest to find answers, I believe that health policy, research, systems reform was like the building block to change the system and be more equitable, right? Well, I don't know. You try to become an expert in all of those things. Like you get the knowledge, you get the education, you get the fancy words. You go into these meetings, high-level meetings, and you start to like speak like them. I don't know if that's the right way. you become like this global public health officer, thinking that solving problems globally will help you solve problems locally. And we've seen it. In this year, we've been to different places in the world, and we see that the people have the same struggles, right, than in our hometown. It's the same problems, it's the same diseases. We call them the isms: capitalism, colonialism, racism, classism. Saki calls it a problem of the mind, and we reframe it yesterday as a problem or a disconnect from the heart and mind. Now, we're all doing the work, but it doesn't look like we have an answer, right? Now, somebody told me a couple of months ago, you can't heal the world, but you can heal your street. And I heard that and I was like, well, what does that mean? Like, does the street literally means like the place that I live? She was referring to that, like I literally live in the hospital that she was working on. So, but then I kind of realized that it was a significant word. It's not a physical space. The street is where my home is, where my people are, where my family is. And when she means heal your street, it means heal your people, heal your family. So that was revealing. A couple of months early, my best friend died, complications of type 1 diabetes, peaceful death, but still coming from the same neighborhood. It was like, what could have happened if I was there? If I could heal my street? So you start pondering and you start wondering about that. But that's, as Mario said, like that's the formula for paralysis. And if we keep there, we're not gonna move forward. I cannot realize that this is not my story anymore. This is our collective story. And the reason why we're here in this place, it's because of all the people that couldn't be here. I think about my friend Jaime. I think about my best friend in med school that also died. It's kind of like a motive, right? I think about Jasmine's parents that didn't have the privilege to be here, but we are. Yes, I can't heal the world, but my street is every single one of your streets, every single one of your struggles. And I realized that connecting with you or connecting with the patients or connecting with anyone gives me a new home and gives me a new purpose to move forward and to try to heal that. So maybe not the world, but every single street in the world could be mine if I connect enough, right? Now, this is the thing that I want to bring you all together and realize what my story is also your story, but it's a collective story. The work that we do happens in opposition to statistics. And it's funny because I'm like trained in statistics and all of that, and it's now how ironic. And what I mean by that is you're fighting the status quo. You're the ones that think this system shouldn't be like that. These problems shouldn't keep happening, and you haven't given up the rage. But I want you to embrace that. Three things, because now I need to add a new thing that I wasn't gonna talk about it. One is, please do not lose rage, and let that rage be your driver. Number two, don't lose urgency. And we talk about that word. It's not an urgency of time. It is an urgency of action. Every single thing that you do, it's against the system. We shouldn't be here, none of us, but we are. And everything that we do collectively and individually is bringing equity to not only ourselves, but the people that couldn't be here, the people that are past us. For example, going to med school, that's an act of rebellion. Getting a PhD is an act of rebellion. Leading with compassion, it's an act of rebellion. And today, I don't feel like I failed. I finally feel like I am moving in the right direction. Someone said yesterday, a rejection is redirection. So taking those words, I also feel like failure is just a reframing of what I need to do and what we need to do together. I know that we don't have the answers individually, but I do believe that collectively, we do. And now, we want to go back to the Power Ranger thing. Power Rangers have colors, and they're supposed to have, in the original series, not in the new ones, but in the original series, they're supposed to have like a trait for every color. So every person was like, oh, he's brave, he's strong. And I have 15 words here that I'm going to read because I don't remember the whole words, but every word is related to every single one of you. And I thought about you, and I thought about the word. And those words are the answer. I learned those from you, and I'm carrying those with me. Empathy, kindness, openness, strength, dedication, friendliness, calmness, hope, determination, passion, creativity, sacrifice, courage, warmness, and resilience. I don't have a word for me, but I don't need a word for me. With you is more than enough. Now, to close this, I just hope that when we are together, we're a force of power and change. And when we're apart, we become a source of empathy and kindness. Thank you.